Bipartisan agreement on health care reform was President Obama's stated goal at his televised Blair House Summit this past Thursday. So was the divide narrowed, or will the Democrats try to go it alone? Joining us from Washington to help put the week in focus is our political analyst, John Dickerson. John, good evening to you.
Good evening, Russ.
So going back to this 7-hour summit on Thursday, from your vantage point, were any minds changed?
Not many minds were changed. Maybe one or two voters had their minds changed, but Republicans came into the room saying the president needed to start fresh, start from scratch. The president said, look, we need to build on what has passed the House and Senate. They were at that divide going into the room. Now leaving the room, they are still in that same divided position. And Republicans are even turning up the temperature, saying the president just isn't listening to the American people, and he's trying to force this health care on the American people.
So at this point, what is next?
What's next is the president has to find the votes. If he wants to try and pass a comprehensive health care bill of the kind he put his name on this Monday of last week, he's going to have to find the votes. That's going to be hard, particularly in the House, where last year they voted on a health care reform package. It passed in a squeaker. Now this bill they're trying to pass causes even more problems. Budget hawks say it goes too far, it's too expensive. Others say abortion provisions in it do not limit abortion rights in the new insurance plan. And there are other people who have even bigger problems. So it's a tough vote counting process for the president.
John, Americans keep hearing this word reconciliation. What exactly is that, and how does it play in this health care debate?
Reconciliation is a process used in the Senate to pass a bill without getting around the filibuster. It requires just a majority. Even though it's a Senate process, it's being used to sell health care reform in the House. House Democrats don't like this bill that's already passed the Senate. In order to get them to like it, the president and congressional leaders have to promise them that a second bill will pass the Senate in reconciliation that would fix some of the things they don't like about this health care bill that's already passed. Senate Republicans are saying you can't use this reconciliation process for something that's going to affect 17% of the economy. Democrats respond, yes, but you've used it more than we have in the past. But this will be one of the big fights.
Okay, John Dickerson, thanks for breaking it down. And as always, thank you for your insight.
Thanks, Russ.